area of medical imaging?
Well, first of all, thank you very much, Rajesh, for the question, and thank you to the Saudi Commission for having me and featuring this super important topic, particularly around non-communicable diseases. So it's been mentioned already that the WHO predicts there'll be a gap of 11 million healthcare workers by 2030, earlier in the day. But when we take that to radiology, and let me explain a little bit, here we're going from the community health worker, we're more talking about hospitals, small community hospitals, imaging clinics, these smaller locations, but really what is often called secondary care or tertiary care. These are your more significant diseases, which are more complex to treat. There you often have a radiologist and radiography equipment, like x-rays, like computed tomography, like MRIs, these scanners, as we sometimes refer to them. And they need to be read by a radiologist. So they produce an image, but that image is sometimes called like the black and white through the storm, the snowstorm. You need a qualified professional to read those images and do diagnosis. So with the rising incidence of NCDs, you see more and more situations where governments want to invest in early screening and diagnostics for non-communicable diseases. And in order to do that, they need to have a more comprehensive radiology offering, and they need radiographers. They need radiation technicians, people who position a patient and take the image. They don't necessarily read the image. So just to kind of give some background of where we're at in this space, just briefly on radiologists as an example, if you look at sub-Saharan Africa, there's about 2 radiologists for every million people. The OECD standard, and where we sit in high-income countries, is more like 93 radiologists for every million people. So you see the gap is tremendous, and what that means on the ground is you might have radiography equipment, you might have x-ray, you might have CT in a location in Africa, in, say, Southeast Asia, that is literally is underutilized. As much as the need is, there's nobody to read the images or to correctly take the images, and of course that's a real shame, given that NCDs are now killing over 70% of the deaths from NCDs come in our low and middle income countries.
So let me just underline those statistics. 2 or 3 per million?
Per million in sub-Saharan Africa in particular, yeah.
Okay, so is that the kind of worst case scenario in the world in terms of like the numbers?
I don't know for sure, but it's got to be close, right? I mean, it's a really dire situation when you think about what that means. It means that women with a breast lump, and they're darn near certain it's a breast cancer. Like I'm a cancer survivor myself, but they're darn near certain it's a breast cancer, but they may have surgery without an image taken, meaning we may cut this woman open because we can't see it clearly, but we believe it's there, without a radiographer to position the patient correctly, and then to somebody to read that image and say exactly where it is. We might do a mastectomy simply because that's the best we can do in that scenario.
So this work is really personal for you.
Yes,
as well.
Very personal, yeah.
Wow. So you have 2 or 3 in sub-Saharan Africa and 93 in the OECD?
Per million, yeah.
Okay, per million, yeah.
Mm-hmm.
So the OECD is going to be probably the top end of the scale, presumably, right? Is there like a kind of mean? I mean, it's still a vast difference. I'm wondering if there's a mean, and if that represents a big shortfall.
I mean, I can't give you a number, Rajesh. I'm not sure what the mean is, but I think if I paint a picture for you, what you want to see is you want to see in a country where they've invested and they have pretty good hospital equipment, there's x-rays for screening for TB, there's mammography available for diagnostic when we believe a woman has a breast lump, there's a CT available for lung cancer, for example. You want to see that equipment fully utilized, right? You don't want to see idle investment in equipment, but in order to do that, you have to invest in skilled workforce, and that's what you often see. And I would say the medium somewhere is probably 2 to 3 days a week that equipment is fully utilized, but it's not utilized to its full capacity because of the lack of skilled operators.
Right, and when governments are facing very tough choices about how they spend very small health budgets, you want to make sure you're getting the maximum mileage out of what you're investing in. as well.
Yeah, absolutely. And with non-communicable diseases, and we're going to hear this a lot this week, right? Tomorrow is the high-level meeting on non-communicable diseases. How do you really do something about that very high death rate? How do you really do something? It's early screening and diagnostic, right? You need to catch disease early. And in order to screen, to have cardiac screening programs, to have cancer screening programs, you need qualified staff, right? And this is not, it's generally not something that we would put in the realm of a community health worker, but you don't have to go too much more skilled to get there, and that's one of the things I want to make sure we talk about.
Right, so that's my very next question. How do you train technicians like radiographers faster than now? What are those ways, and what are the, what's the kind of innovation that allows people to do that?
Yeah, it's a great question because there is this significant need out there. So whether it's a radiographer who's full certified, or it's maybe an allied health worker or a nurse who has now been certified and is approved by the government to do this type of skilling, we believe very strongly in a blended approach. So this might mean some online training, can be instructor-led online training where you can ask questions and things like that, might be just a material that is watched, and some hands-on training. Today, in many cases for radiographers, we insist on 3 to 4 years of hands-on training to get that full certification. You can imagine that's extremely difficult. Many more countries are starting to think about, the equipment has evolved over time, where you have less risk of inappropriate use. The equipment we've also applied AI to the equipment where it does many of the steps for you, including some of the safety steps to say, nope, can't take a scan right now because the patient is in the wrong position. So those kinds of things where you can train somebody in 3 to 5 months to be a certified radiographer using a blended approach of both simulation and then in-person classroom type of training, or even better, on-site training in the hospital that they will be working in.
So you can go from 3 to 4 years down to 3 to 5 months.
Yes. And we're doing that today in the Ukraine, for example.
Tell us some examples of where you're doing that and what you're seeing as a result.
Yeah, this is a great example of partnership. We believe very strongly that partnerships are necessary. We are very often working with universities and other multilateral organizations to put together training programs. At the moment, we have a program that's funded by GIZ, the German Development Organization. It uses content from the American Society of Radiology Technicians. It uses a lot of their virtual content, and we've developed the curriculum with them. And what we're doing is we're training new radiographers and new radiation technicians in the Ukraine in 3 to 5 months with a combination of simulation and virtual training, and then some hands-on training which can be done either in the Ukraine, or we do have an option that they can come to our training academy in Poland. It's a little bit, depends on the site and what works best for the individuals. And we will be training over 300 technicians this year and ramp that up over the next couple of years. So that's a partnership. You have American Society of Radiology Technicians, you have GIZ funding, and you have us as the industry partner.
What's been the result or the impact of that?
Getting those 300 people trained, as all of us know, the Ukraine is unfortunately in very difficult situation where 80% of imaging equipment has been destroyed or put out of capacity, and there's a significant shortage. So investment is coming. Different organizations are investing in new equipment, but they need skilled staff, and ideally they need to build up local staff.
Mm-hmm. Where else? Where else have you been working to train people faster? What else have you seen on the ground?
Yeah, I think, when we start talking about non-communicable diseases, it can be a little complicated, right? People sort of look at cancer and they say, what do we really do to address the burden of cancer? Through the University of Cape Town in South Africa, we've been running a program for about the last 6 years now where we train teams of people from, so far, 13 different countries in sub-Saharan Africa and in Asia. We train them on how to do radiation therapy. And radiation therapy is used to both treat cancer, to remove cancer, and to prevent reoccurrence. So about 50% of cancer cases need radiation therapy in their progression. I myself have had radiation therapy as a breast cancer patient. It's very common in breast cancer. But you need to train a radiation oncologist, you need to train a radiation technician and a physicist. It's a pretty complicated piece of the healthcare pathway. We do this with the University of Cape Town, and these teams They come to Cape Town. We also go to their sites. We're training about 80 teams so far, have gone through that, and that's really significantly increasing the opportunity for radiation therapy for cancer patients. Radiation is not only used in cancer therapy, but that's what we all understand, and that's the typical use.
And because you brought it up about your own story, your own journey, is there a difference in trust for the patient if you know that your technician has gone through 3 to 4 years of training or 3 to 5 months? How do you overcome, that kind of mental hurdle for people? If you were a patient again, God forbid that you ever are again, how would you feel in that environment? How would you rely and be comfortable with your technician that person is properly trained?
Yeah, I mean, this is part of why we partner with organizations like the University of Cape Town. In breast cancer, we have a big program in Cairo with the University of Cairo. It's really because certification is still essential, right? And as the industry partner, we don't set certification standards. Governments set certification standards. They rely on global standards. And so you ensure that people go through certification is one big piece of it. The other piece of trust, though, is not just is the person trained, but is the person really have my best interests in mind? And I think when you have people coming out of the community who you will see at the grocery store, who your kids go to school with, you don't have, you have people that who you're building up part of your community, the trust is also very strong. I mean, a hospital is part of a health system, and you'll often hear, I will say things like, a health system is not a doctor and an x-ray. That's not getting us very far, right? It's also not a nurse and a vaccine. A health system should be very locally built, and that's why we believe so strongly in training and education. We've actually made in our global sustainability commitments a commitment to provide 6 million hours of training per year, with a high focus of that on low and middle income countries, between now and 2030, and continue to ramp that up. So we're investing a lot in building health systems, which we see one of the roles we can play is around training.
6 million hours a year is how many people is that going to deliver?
It depends on the type of training, but it's in the hundreds of thousands, yeah.
Okay, and then briefly, you just talked about the certification partnership in Egypt. Can you tell us a little bit more about that? We just have a couple of minutes left.
Yeah, I just briefly want to comment and give kudos to the Ministry of Health in Egypt. Egypt has a program called Health 2030, and with that, they're looking very strongly at women's health. So they are building up breast cancer diagnostic across Egypt. If you're not aware, over 50% of the women around the world do not have access to diagnostic mammography, and certainly a breast cancer pathway doesn't start with mammography, right? It starts with a self-exam. I'm just going to plug real quick here. I found my own cancer living in Denmark, doing a self-exam. So this importance of educating women to do their own self-exams. But I was very quickly able to get a diagnostic mammogram and get the surgery and intervention. So in Egypt, they're investing in this. Today, it's not part of universal health coverage, but it's coming. And they've invested, we're training groups around the country of Egypt. We're doing this also some virtual and simulator training, but we're going facility by facility and training teams to both position a patient correctly for mammography and to read that mammography. And by doing that, there's no doubt that by 2030, Egypt will have a comprehensive program for their women.
Okay, Tisha, we have 45 seconds left. What is the one thought? What's the call to action you want this group or policymakers who are in the audience, who might watch this subsequently, to leave with and do?
I would think my biggest call to action is really to set a framework and build partnerships to make it happen, right? Siemens Healthineers doesn't do this alone. No one university does this alone. But one thing that we have in all of these organizations, or all these countries around the world, is we have government players. There's very often academic centers who are setting the standards and patient groups. So building a real program that says, what are we trying to do? We want to double the number of people that we're training. We want to ensure that we have this type of screening available. So I think when you have these visionary benchmarks to aim for, we see a lot of progress. And I think it's time to really move in that direction and to do so at a more rapid pace.
Okay. Tisha Boatman from Siemens Health and Siemens Healthineers.
It's not easy to say, but yes, Siemens Healthineers.
Thank you very much for joining us. Thank you.